Welcome to The Breakdown, the orthopedic podcast where we dig deep into the world of bones, joints, and everything orthopedics. I'm your host, Lauren, and today we're diving into a crucial topic, insurance. We're going to talk coverage, copays, out-of-pocket costs, and all the basic information that you, the consumer, should know. Navigating health insurance, especially when it comes to orthopedic care, can be overwhelming. We're going to break it all down for you and help you understand the essentials and how to make more informed decisions. Please welcome my very special guest, Kelli Huber. Kelli is our Business Services Director at Rothman Orthopaedics. She started at Rothman in 2021 in the Contracting and Value-Based Care Department and transitioned over to Revenue Cycle Management, aka RCM, in April of 2023. Kelli, welcome to the show. Thank you for being here.
Thank you, Lauren. Thank you for having me. Excited to be with you today.
Yes, excited to talk insurance because there are so many questions that I personally have for myself. So selfishly, I'm really looking forward to this episode. So I noted in the intro that you started at Rothman in 2021, transitioned to the Revenue Cycle Management Department in 2023, but you've been in the Revenue Cycle Management Department long before, not department, field, world, long before coming here at Rothman. So how long have you been altogether?
Yep. So I started my revenue cycle career in 2007.
Oh, wow.
So I worked for, another MSO company that provided a wide range of services from revenue cycle to population health to technology support, you name it. We covered everything. And there I worked for about 50 different primary care offices, about 1,500 physicians.
Got it. So you were in the insurance world then.
I was.
Because
Yes.
revenue cycle management doesn't necessarily mean insurance. That can mean anything that's producing revenue. But
Absolutely.
you were in the insurance field, so you know the ins and outs. So, ladies and gentlemen, Kelli has the answers to all of our questions today. I can't wait. All right. So, one of the reasons why I wanted to have you as our first guest for season 3, we're starting a new year. It's January. A lot of changes happen in the insurance in the insurance world. So, what advice or what can you what questions should consumers be asking right now as we start, a new year with their insurance? Should they be looking at anything? What tips can you give us?
Yeah. So at the beginning of the year, every year, insurance changes. You could say with your same plan, but your policy may change a little bit. So a few things you want to make sure of when you're either selecting a plan or renewing your current plan is, what are my out-of-pocket costs?
Mm,
And am I going to be able to afford those costs based off of how frequently I go to see my physician, whether it's my
right.
primary care doc or a specialist? Um, and then subsequent to the out-of-pocket cost is, what do I need to be able to see that physician? If I need a referral because I have an HMO plan, are my primary care physician, staffed up enough to be able to get all these referrals out in time? And so a lot of the copays, what are my copays going to be? Is it different for a primary care or a specialist? So majority of the things that I see change in those policies at the beginning of the year are your out-of-pocket costs
Mm,
and what you as the patient are responsible for when you see your physician. And those
got it.
things can really impact how frequently you visit your primary care physician or whether you opt to do elective orthopedic or any other kind of elective care.
Right. So you mentioned a couple things, copays being one of them, but some of the words that I hear over and over are deductibles, copays, and coinsurance. I know what a copay is. That's the one. And I feel like I know what a deductible is too. But can you just explain? We're really making it very basic. We want to know the basic information. Can you explain deductible, copay, and coinsurance so we know the difference?
Yeah. So your copay, obviously, as we spoke about already, is what you're paying each time you walk into your physician's office. So if your plan says that to see your primary care provider, you have a $20 copay, you're going to pay that $20 copay every time you go in.
Right.
Your coinsurance is a portion of the medical costs you pay after your deductible has been met, should you have one. And that deductible is separate from the monthly premium that you pay. So we all pay into our health insurance every
Right.
month. And outside of that premium, you are going to have an out-of-pocket deductible that says for the first $2,000 of your care or whatever your plan's deductible is, it could be in excess of $5,000. For that first $2,000, you are responsible to pay that portion out of your pocket, and your
Mm,
health insurance will pick up the cost after you meet your deductible.
got it.
So you're paying, in essence, for your care at the
Right.
beginning of the year until you reach that maximum out of pocket amount.
Got
And
it.
the co-insurance is kind of just a different way of sharing your eligible cost with your health insurance. So they're saying, we'll cover 100% of your care, but we'll pay 80% and you have to pay 20% of it.
Mm,
And that kind of goes back to selecting your policy at the beginning
your
of the year.
plan.
These are
Right.
the things you want to look into. If I have a condition that I need to see my physician every month for, I know I'm going to have a high out of pocket cost for the first 2 or 3 months of the year. But maybe look at a plan that says, okay, your premium's a little bit more, but you won't have an out of pocket co-insurance or
Right.
deductible.
Right. Got
So
it.
again, those key words when you're picking your plan kind of tell you ahead of time, okay, I need a knee replacement and it's February. I'm going to have a deductible and here's what's left.
Yep.
And the insurance companies tell us. So when we submit a bill, they tell us what your deductible is. That's not up to the physician or the practice or the hospital.
Right.
Your insurance company says
That's
your
already
deductible is
predetermined.
X. It's
Yep.
all predetermined, and
Yep.
you are responsible for this amount.
How
Yep.
about secondary coverage? So I remember, my first position here at Rothman was working at the front desk. That was 22 years ago, and I just remember at that time, and I don't know if this is still the case, but mostly for patients that had Medicare, those patients had secondary insurance because Medicare only covered 80% of the cost, and then the
Right.
remaining 20% was up to the patient, and that's why the majority of them had a secondary so that that could pick up. Is
Yeah.
that still the case where Medicare covers 80%?
It is. Yep. So that's kind of like a billing office rule, right? We know it's that 80/20
The 80
rule.
20,
And
yeah.
yep. So the secondary coverage, if available to you, if you have a spouse and you're both, one's working and one isn't, or if you have state coverage, or if you pay for your health insurance, you can always get that secondary insurance and they'll pick up that 20%. So again, it goes back to knowing what out of pocket expenses you're comfortable with incurring. And if that secondary can replace your yearly out of pocket costs, then yes, go get that secondary
Beautiful.
coverage,
Yeah,
right?
right.
But there are some federal plans that just don't pick up that 20%. So it really goes back to, it's the beginning of the year. I really need to kind of study these different types of plans and what they offer. Because if you're getting a secondary and they're not going to pick up your 20%, what are you paying for that
Right.
secondary insurance for?
Exactly. Yeah.
So
Yeah.
yeah. But if you
Awesome.
can get that secondary and it helps you with your out-of-pocket expense, then that's
Go for
absolutely
it.
the way to
Yeah.
go. Yeah.
So here at Rothman, our physicians are considered specialists in
Yep.
the insurance world. So a specialist is treated differently from your primary care physician or your internal medicine physician. Can you tell us what we need to know about when somebody comes to see a specialist versus seeing their
Yeah.
regular primary care? What's different from the
Yeah,
patient side?
everything. So
Everything.
everything, yeah. So, first and foremost, on the insurance card, it's going to have multiple copays. It's gonna say, PCP copay is X amount, a specialist copay is X amount. Your specialist copay is always gonna be more than your primary care copay. So, as the patients are coming in or ahead of time when we're checking eligibility and benefits, we're gonna look for that specialist copay amount, so we
Hmm.
collect the right amount. Um, a referral, if you have an HMO plan, your primary care physician has to put in a referral for you to see a specialist. The difference there with the primary care is when you see that your primary care physician, you don't need a referral, but to come to a specialist, you do.
Right.
So you're going to want to make sure I have an appointment at Rothman on January 17th. On January 13th or 14th, I need to make sure that referral was sent over from my primary care doc.
Right.
If it was not, you will be responsible for that bill. And we do not like to see patients getting bills
Right.
of
Get
that
turned away.
magnitude.
Right. Yeah.
Yeah. Yeah.
Right.
And then any testing. So if you're seeing a specialist and they're order any imaging or physical therapy or any of those types of procedures, you're going to need that referral again. So you're going to hear us use that word a lot today.
Right.
Yeah.
Okay. So I thought the best way to kind of go through all the needs and all the to-dos from a patient side is to go through an actual patient experience. So, and then we can kind of walk through step by step how insurance comes into play, what we need to know, how we can be better prepared.
Right?
So, okay, so I schedule my appointment at Rothman. I personally have Keystone Point of Service. So, I have, if we could cut to the image, I have an image of the front and back of my card. And I'm going to say this right now. I couldn't find my insurance card. So this is my daughter's card. I blurred out the
Okay.
name and everything.
Okay.
But so that's my first question. Do we actually need the insurance card? I mean, with today's technology, can it just be pulled up on a computer, or do we really need to bring in that insurance card at every visit?
Yeah, I mean, so that I can answer that in a couple different ways. First, I'm going to say before you even come in, if you have a scheduled appointment, we're pulling your insurance information.
Right,
And on
right.
the insurance website, there's electronic copies of your card. We're a step ahead of you. We have that. I think the
Beautiful.
most important part of bringing in your card at that time, at that visit, is just to have a copy of it scanned into your chart. Um,
Hmm.
it's 2025. We're kind of moving out of paper this and,
Right.
physical cards and all of that. So is it going to stop the appointment? Absolutely not. Are we going to get to a point where we say we don't even need you to bring it in? We could get there. Again, we're relying on the technology of the website, having it available. And there are times when websites are down or it's the new year and
Right.
a copy of your card has not been published to the website. So it's kind of a safety measure
Yeah,
or a gap,
backup.
so to
It's
speak, to
always
have you
good to
bring it
have.
in. Yeah.
Yep. Okay. All right. So looking at my card here, so I have Keystone Point of Service. How would I know off the bat? So actually, right away, I can see that specialist copay is
Yeah.
$50. So you mentioned that earlier. So I could see it outline the PCP copay, specialist copay, ER, and so on. On the back, it does make mention about needing a referral or bringing a referral. So is that the primary way of how a patient would know if they need a referral or not?
It is. The rule that we usually go by in Rev Cycle is if you have an HMO plan or a
Mhm.
POS plan. So as you
Right,
mentioned, you have
which I
home
have
service.
POS.
Those plans need a referral always.
Right.
But it will also tell you on the back of your card, which is
Got it.
another important reason to always have you or your daughter's card
Got
available.
it. And when requesting when requesting a referral, um, I need to call my primary care, as you had mentioned before. And just from being in the orthopedic world, I remember having to tell patients, that you'll need your MPI number. So, or the primary care number, the primary care physician's office needs the NPI number, our NPI number, Rothman's NPI number, to issue that referral. So, and just from my experience in marketing, there are two types of MPI numbers. You have your group MPI and your individual MPI. And this is just for education matters for patients that when you're requesting a referral, it's always best to get the referral with the group NPI, correct?
That's correct. Yeah, and the reason for that is we have PAs that will see physician assistants or nurse practitioners that would see patients. They would be covered under that group NPI. So if I say to you,
Right,
I'm going to come in and see Dr. Vaccaro and here's his NPI number. If I come in for that visit and I see a nurse practitioner or a physician assistant first, that
right,
claim will not get paid.
right.
So we want to use that group NPI that covers Rothman Orthopaedics across the board. And I can see anyone when I come in, should I need to see someone other than who I scheduled with.
Beautiful. Okay, wonderful. So back to the experience. I made the appointment. Okay, it's my appointment day. I go to the office, I check in, I pay my copay, I hand in my referral. That should actually be electronic, right? They'll
Electronic.
have that
Correct.
electronically, so I don't really even need to bring that in.
Yeah.
Now I get to see the doctor. Finally, it's like getting to see the wizard. We got through. All right. So from there, a number of things could happen. So the physician, we'd have the evaluation and everything. One of the things, especially being in orthopedics, is an X-ray that would be needed. Now, 9 times out of 10, they're going to want that X-ray before I even go back. And in all of our Rothman offices, we have an X-ray facility, or an X-ray machine. So, if my insurance covers me to see the Rothman physician, am I automatically covered to have that X-ray? How does
You
that
are
work?
not. You are not.
Oh boy.
So again, we're going to go back to that plan type and the knowledge of what that plan covers. So HMO plans, point of service plans. you usually are capitated to a radiology facility. So that
Right.
HMO lingo means a lot of things in the insurance world. That really means your insurance kind of, for lack of a better term, has control over where you can go
They
and who you can
dictate
see.
where
They
I
do.
have to go for certain
And if you
testing
go
and things.
outside of that, you're
I have to
responsible to pay
pay,
that
right?
bill. Yes. So HMO plans, we tend to not want to do x-rays in the office unless we are contracted with that insurance to do that.
Got it.
So your front desk folks, your x-ray techs, your medical assistants as they're taking you back, they have this knowledge.
Right. So they'll
So
know.
they know, yes, they'll be able to say, hey, you have an HMO plan. We usually don't perform x-rays on HMO plans because you're capitated to a site. Or we know your HMO plan says Rothman does x-rays at their facility. We're going to cover it because the patient needs it. What's a medical necessity.
Mhm.
So they'll kind of guide you through that as you're walking through the experience here.
Beautiful.
If we cannot perform your x-ray, we'll tell you where to go. We'll say,
Right.
you have an HMO plan, you're capitated here, go get that x-ray. Once we get the report, we'll take the next, plan for your care.
And so the same process would work for an MRI, a CT scan, any type of
Absolutely.
study imaging that the physician requires. Same thing. Depending on your plan,
Absolutely.
you're going to have to figure out where you need to go. You have to
That's
always
correct.
check in with your insurance.
Yeah, x-rays are a little more kind of lenient by the insurance companies. They know that they're not a hefty cost. It's medically necessary at that time of the visit. Now, when we get to MRIs, CT scans,
Yeah.
9 times out of 10, they require an authorization. And we're going to say to you, we're going to refer you out for this study. We at Rothman will obtain that authorization for you and give you that information to go get your study done.
Yep.
We're sending you out majority of the time for those.
So let's talk about that. So that's technically called a pre-authorization, right? Is that
Correct.
okay? Pre-authorization mostly for an MRI study, which our physicians order tons of, CT scans. So basically, we need to convey to the insurance company that this is necessary, that these studies are necessary, and the insurance company has to authorize whether or not they're going to pay for it. Is that
That's it.
basically it?
That's accurate. We will give the medical necessity documentation to the insurance of why the physician feels the study is necessary, what they're looking for, and what they are looking to rule out. So a lot of times on your script, you'll see rule out and a diagnosis because we're trying to make sure something else isn't happening to you
Right, right,
before we proceed with our care plan. And we'll submit all of that to the insurance, and then they'll say, "Okay, we authorize the patient to move forward with this, or we don't, and we want you to do X, Y, and Z."
right.
So we convey that information from the insurance to the patient prior to them getting that study.
And the process for that is it in fact a phone call from our end? I feel like I hear this more from the patient side where I'll get a call like, your office was supposed to get this pre-authorization. I haven't heard anything yet or whatever it is. And then I'll reach out to our staff and they said, I made the phone call. And I'm like, wait a minute, you actually had to make a phone call. There's not like a
Yeah.
system or an app or anything that you could go into, I don't know,
Technology.
request
Yeah.
the pre-authorization. So our team is having to call the insurance company, possibly wait on hold. What is that like? What's the turnaround time for something
Yeah.
like
I mean,
that?
so some insurances do allow you to do this on their portal. So
Great.
you submit it on the website, but then there are times where it says, this can't be processed, call this number. So we're back to
Mm,
the phones. And some
right.
insurances don't allow you to submit it on their portal at all. And it is that old school way of picking up the phone, sitting on hold, you're ninth in line for your call to be
Oh
answered.
my goodness.
And then it's usually, okay, we've gotten all your documentation from the visit, the medical necessity for this test, we'll get back to you. And that could take up to 5 days for the insurance company to get
That's what I was
back.
going to ask. Five
Yeah.
days.
Sometimes longer,
Okay.
depending on what it is. When we get into the, complex world of spine or
Yeah.
joint replacement, it could take even longer. But if we're doing something, let's say an MRI to see if we need to do a partial knee replacement or a total knee replacement, those usually turn around a little quicker.
Right. Right.
But in the more complex cases, we could be 5 to 7 days before we hear anything back.
Amazing. Amazing the
Yeah,
control of the insurance company.
absolutely. They run everything.
Um, okay, so those are one scenario of how a visit could go where the physician, requires next steps as far as studies and imaging and things like that. Another scenario could be that he or she prescribes non-operative treatment like physical therapy and injections and things like that. So again, when it comes to insurance, I'm sure it's not a one size fits all. It depends on your plan. We have physical therapy at Rothman, but again, we may just because you saw one of our physicians doesn't mean that you're covered at our physical therapy facilities. So, what's your recommendation just for the patient to call their insurance company and find out, or do we provide like
Yeah.
lists of where patients can go
So we
for
do. I would
PT?
say I would go down both paths. So again, we're going back to that kind of HMO terminology, right? The HMO, my insurance really dictates what I can do in
Right,
that HMO world. So for those plans, you're again usually capitated to a physical therapy site. So we would say we're, referring you for 6 visits of PT. Your insurance says you're capitated. You'll have to call them and find out what site you're capitated to.
got it.
When we get out of that HMO world and we're into a PPO world,
Hmm.
that basically says I pay a little more in my premium so that I can access anyone I want,
Anywhere. Right,
anywhere. Then we'll say Rothman, has our own physical therapy sites that those sites communicate with our Rothman physicians, openly to talk about care and care plans. We would recommend you do your PT here, and we'll give them a list of different locations where we offer PT, and they would call to schedule at that
right,
point.
right,
And again, that care team, your clinical assistant, your physician, the front desk, they're all aware of these rules, so they can
right.
help guide the patient through
Yep,
that.
that's beautiful. I'm going to throw a phrase or term out there for you that I've heard over the years that often has a lot of questions around it. Fracture care.
Yeah,
So, fracture care, we're orthopedists. We see bones, we're going to see fractures. But fracture care is sort of like a package deal. Explain what fracture care is for patients
okay,
that may be seen for a fracture and
sure.
qualify for fracture care. What is it?
Fracture care, that it is a package. So if you come in and you have a fracture, there's five, maybe I'm no physician, but I think five types of fractures.
Okay.
And as you come in, we'll treat you with the X-ray if necessary, unless you have your own from an ER visit or something that we can like legibly read the report, clearly see the images. And then that fracture care includes setting. So we're going to set the bone in place where it needs to heal. It could be casting, so fiberglass cast for the fracture. It could be an orthotic, a boot, a wrist splint,
Right.
um, whatever the physician at that point deems medically necessary for that fracture, whatever type of setting and device or casting is necessary. And that fracture care visit, so I'm seeing today, I get my fiberglass cast and crutches, and I go home. That carries what's called a global period. And
Okay.
that global period is 90 days. So for the next 90 days, any care I need for that specific fracture is included in my fracture care bundle. So I'm not going to be charged an office visit. I'm not going to be charged a copay for a follow-up visit. If
Mm,
I come back in and I say, I'm not sure I'm healing correctly, I still have a lot of pain, I can't put pressure, and you said in 4 days I should be able to put pressure, an x-ray is performed. All of that is covered in your fracture care bundle. So
okay.
no additional charges are incurred or out of pocket is necessary for that 90-day period because we're treating that fracture. We know it's not going to heal in one day. We know
Right.
we need a period of time where we're going to have to see you again, adjust the boot, get you different crutches, whatever it may be. And that is all included in the cost for that original fracture care
So,
appointment.
what could that cost out of pocket for a patient?
Yeah, it really depends. So again, there's different types of fractures on different body
Right.
parts.
Right.
Charges are different. If you have a deductible and the insurance says, well, the bill was, I'll make this up, $500 and you're responsible for it, it could be that $500.
Oh,
If
wow.
you have an 80/20, then it's just your 20%. But again, you get all that additional care that's necessary in that 90-day period, in essence, for that one time
Wow.
charge. And
Okay.
yeah, so it really could depend on what your plan dictates your out of pocket costs are.
Got it. All right. So, now the final scenario that could happen is that the physician recommends surgery, which nobody wants to hear. Nobody wants to have surgery, but obviously we do a lot of surgery here at Rothman. Um, is there anything what should the patient at that point, what do you recommend when a patient's told that they need to have surgery? Um, one thing that I'd like to mention is, we have close to 200 physicians.
Mhm.
They operate out of multiple different hospitals. Um, my insurance may not be accepted at one or more of the hospitals that they operate out of. Just because my insurance covers that physician, it doesn't mean that it's
That's right.
covering the hospital care.
Yeah.
So I guess at that point, just sitting with the surgery scheduler, they would review my insurance plan and where I can go and help me sort of navigate any
Yeah,
information
absolutely.
that you
So
can provide.
that's all accurate. Yeah, but even a step before that, our physicians are so well versed on what insurance plans at what facilities that they
Oh,
operate at.
wow.
We have
Good.
open communication with them. They know if I'm sitting with an Aetna patient, I can only take them to X, Y, or Z.
Got it.
But that will go over the surgery scheduler will go over with the patient as well. So physician recommends surgery, you'll sign a consent with the physician or their clinical assistant in the room, and then you'll head out to that surgery scheduler and they'll say, if it's only one facility, here's the days that are available. Let's schedule you for one of those days. If it could be multiple facilities, we'll talk about what's closest to home. Have you been to a facility before you're comfortable with? We'll go
Right.
there. Um, and then at that point, the surgery scheduler actually sends that whole packet of information home with the patient and that same packet of information over to our corporate office
Okay.
to Rev Cycle, where we have a centralized team that works on, we're going to go back to that pre authorization word, works on the pre authorization for that surgery. So the team
Mm,
will call the insurance, submit all the medical documentation. Why is this necessary? We've done X, Y, and Z leading up to this surgery. They're not getting any relief. We need to perform the surgery. When we talk with the insurance for that pre authorization, they'll say to us, okay, for this surgery, the patient has an out of pocket of $1,000 to see your physician and have this surgery. I think the confusing part for the patient at that point of the process is that $1,000 represents your surgeon. It does
okay.
not represent
The
any fees
hospital.
or out of pocket costs for the surgical facility or the hospital.
Got it.
That is completely separate from Rothman. We are strictly just the surgeon.
Mm,
So, a lot of our surgery schedulers, again, well versed, they know this. They're going to say to the patient at the time of signing up for surgery, we can tell you what you're potentially going to owe to your surgeon, but we recommend you call the facility and you find out from the facility what their costs are and what you may be responsible for, because you
got it.
will, in essence, get two bills.
Right. Oh boy.
So we also have a centralized team of financial counselors that once we find out what that out of pocket expense is going to be, we call the patient and
Okay.
we sit, we talk with them. Here's different options. Here's how much you're going to owe just for the surgeon. Um, we can do payment plans if they want to pay in full. We can have, we'll set them up a way to pay online. If they really can't afford it at that point, we'll go back to the physician and say, the surgery is necessary. However, the cost is just excessive for the patient right now. How do you want to handle this?
Mhm.
So we really try to work with the patients on ensuring that we're not putting a financial burden on them. But if the insurance says you owe this money, we have to follow that guideline and
Right.
we have to follow what they basically tell us, to collect.
Got it.
But we work with you, payment plans, half now, half later, whatever fits
Yeah.
your budget. Yeah.
Got it. I forgot to mention this earlier when I showed my insurance card, but along with my insurance card, I have what's called a Navia benefits card. And it's like
Sure.
a little credit card that I can use for, I don't know what, I guess like my copays. And here's the thing, at the end of the year, I think I get like a recap of, how much money I have left on it. And I always forget about it. So you're talking about these out-of-pocket costs for surgery.
Yeah.
Would that be something my Navia card could contribute
You
to? Could I
can.
use
Yeah.
that?
Yeah. So that's your health savings account, your HSA card. You can use that for copays, deductibles, co-insurance, um, really prescriptions, over-the-counter medications at your pharmacy, medical supplies. So if you come in and you need a boot or crutches,
I
you can
could
use that
use that.
card. Yep. There's a lot of things even just outside of our orthopedic world that you can use that for. There's a lot of dental vision costs.
Right.
So you put into that out of your monthly premium or your check, you put into this health savings account. You can use that all year long. And really towards anything. I think you could even use it towards your insurance premiums
Right.
if
wow.
yeah,
Yeah, it's just a
it's
matter.
very
So
versatile.
anybody out there that has one of these cards, and so Navia is just one of many
Millions,
cards,
yeah,
right?
different,
So
yeah,
they have lots of different names and everything, but they're a health savings account, right?
that's
It's
correct.
your health
Yes,
savings account,
it's your health savings
and this is
account.
money that you put in, right, at the beginning,
Correct.
and
Yep.
then you just use that for your whatever your
Yeah,
needs
a
are
lot of
throughout the
people
year.
set it up to be by paycheck. So you would put in however much you designate each paycheck. It's pre-taxed. And then it kind of holds it for you on this card. It's similar to a credit card. You have X amount on there that you can spend. And
Mhm.
you can use that for all different reasons. And then at the end of the year, I think there's an option at the end of the year where you could either roll over what you have left or spend it all at the end of the year. If you want to go in and buy asprin and band-aids and all
Right,
these things
right,
at
right,
pharmacy, then you have a little extra cushion to spend that money and get some, at-home supplies or but
right.
it really helps too with those out-of-pocket costs. I think in the, what we see now in the world we're in, your out-of-pocket costs are excessive. They're
Increasing,
very
yep.
expensive for care. But
Mhm.
if you can use that HSA to pay off some of those balances for you, it's a
Yeah,
huge,
use it,
yeah.
right, for sure. You mentioned earlier too about deductibles and meeting your deductible. Now we're talking about surgery, that perhaps surgery could be an option for somebody or would be an option. Um, it seems patients may try to hold off surgery towards the end of the year when their deductible is met. That way, it's not so much of an out of pocket cost. What do you any tips or knowledge that you can share? Is that maybe a
Yeah.
better move, or do you not recommend it?
So I don't recommend it. And I'll tell
Okay.
you why I don't recommend it. I can support a patient in saying I can't afford $5,000 for an elective procedure. I completely understand that. However, at the time you're feeling like it's an elective procedure, it may be, but delaying that care
Yeah.
can turn into, a long-term problem.
Right. Can
It
make
went
things worse.
from
Yeah.
I need, an epidural injection to now I need a full cut open
Oh
surgery
boy.
that's going to
Yeah.
take hours.
Right.
So, I say don't push off your elective orthopedic care until your deductible's paid. You can use your HSA. You can get on a
Yeah.
payment plan
Right.
for out-of-pocket costs.
There are
I
other
would say being
options. Yeah.
proactive with that care is important. It allows early detection, minimally invasive treatment if we catch it early enough.
Yeah.
Better quality of life if you
Yeah.
treat it when it starts. So I do not recommend waiting until the end of the year. Um, I know it's financially questioned. It's questioned a lot in that financial world,
Right.
but we can help you with that. So
Yeah.
we say if you feel something in March, come in, get ahead of it. Let us try to do the non-invasive surgical plan if that's an
Right.
option before it turns into one.
To something
So
worse. Right.
that would
Yeah.
be, yeah, that's my
That's
recommendation. We're
great.
here, Rothman's here all year long.
Right.
Let us help you get to a better quality of life and don't push off, it could turn into long-term rest of your life problems, injuries,
Absolutely.
arthritis, spinal conditions. You don't want to wait
We
on
don't
that.
want to do that. No. All right. So I feel that we've sort of gone through all the scenarios. My next question to you is, okay, we get so many calls. They come through the call center, they come to the billing department. What are patients calling for? What's the number one call that comes through to the billing line that maybe we can give that information now to people listening so they don't have to make that call?
Yeah. So, I'm very proud to say our number one call volume is for appointment scheduling.
Okay.
Uh,
Yeah.
I
People
don't
want to get
think
in.
that a lot of physician offices can say that, but we are so technology savvy that any questions that patients have, we have on our website.
Yeah.
We're up on it in a sign in our offices. Now, I will say we do have a large volume of calls for I got a bill and I don't know why.
Mm,
We will never get away from that. It's just patients get bills. They thought they paid their copay. Now they're getting another bill and they don't understand it. Or they're not in the medical field. They don't know what these words and the terminology means on their statement or the little codes the insurance companies put on there. They don't know what that means. So
right.
a high volume of calls for, I got a bill. I don't know why. Can you help me explain it to me? Can you put me on a payment plan? Or scheduling. I need to schedule an appointment. I think it's my hip. It might be my back. Let us help you navigate through
Yep.
that. So we have a centralized call center that takes incoming calls for appointments. We have technology configured to ask a certain subset of questions based on body part to make sure we get you in with the right type of physician.
Physician.
We have
Mm-hmm.
such a wide range of specialties here that we want to make sure you're not coming in and seeing a doc that's going to support your knee when truly it's your back. We want to get you where you need to be first. Let's not
Yeah.
incur additional bills, waste anyone's time. So we'll navigate through that phone call with you of asking you, where did the pain start? Is it, left or right? Is it sitting or standing? Um, so we have that. We'll explain your bills to you. We'll walk you through how to make a payment online if that's what you prefer.
Great.
So we do have, like I said, centralized call centers that will take those incoming calls and help
Yeah.
navigate you through any questions that you have.
And for patients that or listeners that may not be aware, we have an entire patient portal where patients can log in, they can get their studies, they can book their appointments, they can pay their bill. So there's a number of options through the patient portal there. Anything else
Right.
insurance related on the portal that patients should be aware of?
Yep. So we have a list of insurances that Rothman participates with.
Okay,
So you know ahead of time whether you're trying to schedule online or looking for the 800 number to call us. Do we take your insurance?
got it. And that would
Nine
be
times
on our
out of 10.
regular Rothman website.
Yep.
We have the insurance tab there and lists
It'll
out.
just explain everything to you. What do we
Yep,
take? And then on there, we'll have how to make a payment, our 800 number, centralized scheduling. You can go through
beautiful.
the online scheduling process on that website. And then it'll give you a link for the patient portal. So once you're an established patient, you can set up that portal. You can make your appointments through there. You can see your visit notes through there, your imaging reports or images. Um,
Amazing.
any billing question or billing, that's on there
Statements and
you may
stuff.
owe. Yeah. So that comes once you're an established patient, but leading up to that, utilize the Rothman website. It has an abundance of
We
information
even
that
have
can
those
help you.
MPI numbers on the
We sure
website. We
do.
have the
We
group
sure do.
MPI numbers on there. And the billing line is, just in case if anybody needs to call right now for a question about their bill, we have a billing hotline, right? It's 267
We-
339 3558.
That's correct.
267-339-3558. So if you
Yep.
do need to call, if you don't have access to a computer or you really just want to talk to somebody, you can call at 267-339-3558.
Yeah, let us help you
Um,
walk through any questions. We have experts on the line Monday through Friday. I think they're open from 8 to 5 or 8 to 6. So,
oh, wow. That's
yeah, lunch
late.
breaks on your ride into work, whenever you need to call, we're there to help you.
Wonderful, wonderful. So, just one final question, Kel. This has been so informative. I'm loving it. My
Right.
final question: anything that patients can be proactive when it comes to insurance or orthopedic care? Here's the thing: I feel that orthopedic care. It's hard to be proactive because I could walk outside and slip and fall,
And fall.
and you don't know.
Yeah.
But any
I
tips?
would just
Anything that
say,
we?
yeah, I think I would just say know your coverage, right? When you
Yeah.
when you select your plan at your open enrollment period, know what's covered. Make sure you have urgent care coverage. Know
What
your
do you
out of
mean
pocket
by urgent care
expenses.
coverage? Is that a separate coverage?
It some plans don't offer to pay for those urgent care centers. It would be all out of pocket.
Oh.
Again, going back to your card, you should have a
Yeah. Do
care
I have urgent
copay,
care
specialist
coverage?
copay, an urgent care copay, hospital copay.
Wait a minute. I need
And the
to
reason I bring up the
look.
urgent cares is because we have one. So if you're outside and you're shoveling, now we're getting some snow and you hurt your back or you hurt your knee, we have walk-in centers and urgent cares. You can walk into a Rothman urgent care the minute after you get hurt and get care.
Oh my
So
goodness.
you want to make sure you know what your out of pockets are going to
Yeah.
be, what you're responsible for as a patient. Do I need to send any documentation to my insurance after I receive care? Um, did I sign up for, online only? I'm not going to get any EOBs in the mail. Just know all of that information going into the calendar year if you have new coverage or even
Yeah.
existing coverage that could have changed.
Changed. Right.
Yeah. So you just want to know what your plan covers, know ahead of time in case, like you said, you do step outside and you fall and you get hurt. At least I can say, okay, I know I can run over to the Rothman
Exactly.
Urgent
You know what your
Care.
options
I'm gonna have
are.
to pay $50, but I'm gonna get care immediately, and they're gonna have a plan for me when I walk out the door of what I need to do next.
Right. All right, now I need to find out if I have this because looking at my card, it doesn't
There's
say
no urgent
urgent
care
care.
copay?
It says ER. I have PCP, specialist ER. I don't know what IND, oh, deductible, individual deductible,
In
family
network, out of
deductible.
network, yeah.
Yeah, I don't have urgent care. All
Yeah,
right, I
so I
need to
would look
change
on
that.
I would look online and make sure you're covered to go to an urgent care. They may apply your ER copay to your urgent care visit. But again, so it's a good point, right?
Yeah,
If you get hurt right now walking out, you
right.
don't know, can I go to an urgent care?
I don't
You
know.
want to know that information. Yeah,
Kel,
you want to know
thank
that.
you. Thank you. I can't thank you enough. This has been wonderful.
Yeah,
Thank
it's
you for
very good to
your
have that information.
Yes. Thank you for your insight, your knowledge. I hope
Mhm.
everybody feels a little bit more empowered in understanding the complexities and how to navigate insurance coverage, especially when it comes to orthopedic or specialist
That's
care.
right. Knowledge is
Um,
power.
Knowledge is power. That's
Knowledge is
right.
power.
Cal, thank you so much. This has been so informative. I mean, for me personally, now I know I need to go back and figure out if I have urgent care coverage. And
Yeah.
by the way, I've been distracted. I love your background back there. Are those our birds?
Those are our birds. So
All
yeah,
right.
another when we talk about our specialties and what Rothman offers, we do a lot of sports injuries. So again,
Yep.
we kind of bring the two together. The urgent cares if you get hurt playing a sport. As you know, our physicians cross over different sporting teams and our birds being one of our partners. And
Go birds. Thank you, Cal.
thank you.
Kelli, thank you so much for your insight and knowledge. I hope all of you feel more empowered in understanding how to navigate the complexities of insurance coverage. Be sure to stay tuned for more episodes and feel free to send in your questions. Until then, stay healthy, stay strong, and take charge of your health. I'm Lauren, and you've been listening to The Breakdown.